Hi everybody, this is Dr. Becker. I'm going to be off camera on this video. This is a follow-up visual aid to my prior tailbone video. Obviously this is my plastic spine that I use in the office for a visual aid. This is exactly what I would be showing any patient in my office. Obviously here at the bottom is your tailbone. This bone above is your sacrum. These are your ilium bones. And right here where the coccyx meets the sacrum is the sacrococcygeal joint. And somewhere in there usually the joint is moving too much in, sideways, or it's rotating, or a combination. When you're in the office, patient with tailbone pain, I'm feeling the area as much as possible, trying to locate the pain. But if the pain is near the tip of the coccyx, you also have ligaments that travel from the coccyx to that sit bone on both sides. And these ligaments form a web that all the pelvic floor muscles attach to. And while you might have pain just at the tip, we need to feel all of the muscles surrounding that area, but also that ligament. If you think of the coccyx as moving over to the left a bit, this distance becomes shortened. And conversely, this distance becomes lengthened. This ligament shortened becomes looser. This ligament pulled longer is tighter. So I want to feel the pressure and the tightness of those ligaments. I also spend as much time as possible feeling outside the lower sacrum, the side of the coccyx, the lower sacrum on this side, the side of the coccyx, trying to get as much information as I can about which direction it's moved and how so. Once I have that idea in mind of where it is in space, I then take a gloved finger and go inside. Again, I start feeling the side, feeling any increased motion. But once I'm already there, and I have now confirmation, hopefully, of what I felt when I was outside the coccyx or outside the rectum, I can then decide how it needs to move. If it's off forward, I need to move it back. If it's off to the left, I may try to go back and to the right. All of those decisions are already made. Once I'm in here, all the embarrassment is already over with. I might as well adjust using both fingers, creating leverage. I'd like you to think about how hard I can push this way. It's not a lot, but again, we're just trying to start motion. That's the key. You know, if you think of pelvic floor therapy and trying to loosen all of these muscles that are attached and attached near the genital organs, that type of thing, all of that is well and good, but it's usually not going to change the joint here. Now, you could have other problems in your pelvic floor, but pelvic floor therapy for tailbone pain, again, is not going to add motion. It might loosen the muscles or the ligaments, but you're not, again, directly at the problem. One finger inside, this is as close as you're going to get. It is probably the best answer for solving that issue. If you have any further questions, again, please visit my website. If you'd like to call, please do so anytime. Happy to take your questions and help answer as much as I can. Take care.